The lawsuit primarily concerns an action that was taken by my employer, the Connecticut Hospice, Inc., after I had an industrial accident at Hospice, which I reported to OSHA. For 10 years, I had been director of complementary therapy at Hospice, working with patients, families, and staff members, doing relaxation therapy and participating in the weekly independent team collaborations about the care and well-being of each patient. After my reporting to OSHA, I was taken away from the hospice in Branford that I had been working in for 10 years and sent to all of the satellite offices, Shelton, Farmington, Norwalk, Wallingford, to do presentations that were part of what I was told was the home care objective that had been formulated months earlier. However, they would give me no details on the home care objective, and as a consequence, I spent the next year being sent out to do presentations at places that did not expect me to be there. I would arrive and they would not know who I was or what I was doing in their facility. I was very often asked to drive hundreds of miles a day from Greenwich from West Hartford to Greenwich, then back to Branford with a starting point in Shelton, Connecticut. And previous to my industrial accident, I had had a car accident during which I broke my pelvis in 2 places, 7 ribs, and punctured a lung. I had PTSD as a result of my car accident that was exacerbated by the industrial accident, and that was not taken into account. My termination with hospice occurred when I was told that my only duty at hospice was to drive all over the state of Connecticut. There were no other duties within hospice with which I could perform, and my doctor and a psychiatrist both stated that they did not approve of the excessive driving, and that if other work could be found for me, I was ready, willing, and able to work, but I could not do the driving. When I worked at hospice, I worked with the most wonderful people I had ever worked with in my life. The doctors, the nurses, pastoral care, social workers, the art department, they were all consummate professionals. They knew their jobs individually, but we had a system called the independent team concept where we got together once a week and discussed every patient in the hospital. So everyone, being different, could get the best possible care that we could give them. I learned things about the other disciplines that I don't think I would have been able to learn anywhere else. I mean, would I like to go back to hospice and work at hospice? Yes. I mean, it would be foolish for me to say no. But what I want is for the hospice concept, for the hospice ideal to be available in Connecticut, in Branford, for the people who need it. I want families and patients to have quality of life and to have a forum with which they can present their needs and their wants and be listened to and have their needs and wants acted upon. That is the ideal of hospice, and I will do anything possible to allow that to happen.